Special population presentation by Brianka Larkin. What is mental health? Our social, psychological, and societal well being is referred to as mental health. It has an impact on our thoughts, feelings, and behavior. It also has an impact on how we respond to stress, interact with others, and make choices. Mental wellness is important at all stages of life, from childhood, adolescence, into adulthood. Mental health is an essential component of overall health for both children and adults. Mental health, many adults with mental disorders have symptoms in childhood and adolescence that were not acknowledged or addressed. The earlier treatment is begun for a young individual with symptoms of a mental disorder, the more effective it can be, and earlier interventions can help avoid more serious long term problems as the child grows. Being mentally strong during childhood involves accomplishing developmental and emotional milestones as well as learning good social skills and how to deal with problems. Children who are mentally healthy have a higher quality of life and can perform well at home, school, and in their communities. Mental disorders in children are defined as significant changes in how children usually learn, behave, or manage their emotions, resulting in distress and difficulties getting through the day. Many toddlers experience occasional fears and worries as well as disruptive behaviors. If the child's symptoms are severe and persistent, interfering with school, home, or play activities, he or she may be diagnosed with a mental illness. Nearly 1 out of 5 kids in the United States has a mental, emotional, or behavior disorder, and children and youth with special health care needs are at increased risk. According to the Children's Mental Health CDC, the following percentage of children at any given time experience the following mental health problems in the United States: ADHD, behavior problems, anxiety, and depression. There are a lot of factors that contribute to having a mental illness, some being things we have no control over, such as our genes, family history, and other being such as life experiences, stress, and trauma. Some concerning signs in children are frequent tantrums, not interested in playing with other kids, struggling academically, unable to sit still, complaints about frequent stomach aches or headaches with no known medical causes, are in constant motion and cannot sit quietly except when they are watching videos or playing video games, sleeping too much or too little, having frequent nightmares or seem sleepy during the day, struggling academically or having experienced a recent decline in grades, repeat actions or check things many times out of fear that something bad may happen. As parents, it's sometimes hard to recognize if our child is just normal, fine, finding themselves behaviors, or if they are having problems. And sometimes we are afraid and in denial when we do realize they are different. But there are certain things in places to narrow it down, such as if symptoms persist longer than a few weeks to months and interfere with the child's daily life at home, school, or within public. Signs and symptoms are displayed differently in different age groups in adolescence. Some signs of concern would be self harming behavior, thoughts of suicide, depression, having periods of high and low energy, engaging in risky behavior, diet or exercising excessively, or fear of gaining weight, spending more and more time alone and avoiding social activity with friends or families, smoking or using drugs, engaging in risky or destructive behavior alone or with friends, so that they think someone is trying to control their mind or that they hear things that other people cannot hear, and having periods of highly elevated energy and activity and requiring much less sleep than usual. Assessment or tools to screen and diagnose mental health issues in pediatrics. The DSM 5 is a tool assessment used to diagnose mental health disorder. Um, it consists of 17 or 35 questions versions, which checks for behavior and attention issues in ages 4 through 16 years of age. The SDQ is a 25 question screen done for problems with attention, anxiety, and depressions, and it goes for ages 2 to 17 years of age. There are numerous tests that can be used to diagnose children with mental health disorders, such as the patient health questionnaires. They all screen for depression, anxiety, panic attack. They can be used for different ages, depending on which questionnaire is specific to what's going on with that adolescent. Some of the most common childhood conditions are ADHD, anxiety, depression, autism, and behavior disorders. Childhood mental illnesses are treatable and manageable. Based on the best and most recent medical evidence, there are numerous treatment choices. Everyone engaged in child treatment includes parents, doctors, the patient, and they should collaborate closely. It is critical to address the requirements of adolescents suffering from mental health. Adolescent mental health depends on avoiding being institutionalized and over medicating, prioritizing non-pharmacological approaches, and respecting the child's right in accordance with the United Nations Convention of the Rights of the Child and other human rights documents. The treatment usually consists of medication and therapy. Medication can be a useful component of the treatment for a variety of childhood and adolescent psych disorders. Before starting that medication, the clinician prescribing the medication should discuss the following with the parents: results of the assessment, target symptoms, risk of the illness if untreated, potential benefits of the medication, known risks, side effects, and whether the medication is being prescribed on label or off label. Medication has been proven to help with mental disorders, but it is always recommended to try non-pharmacological interventions in therapy. There are a lot of medications out there that are beneficial for treating mental health disorders in adolescents. Non-pharm type of interventions, such as therapy, is very helpful for not only for everyone with mental health problems, including adolescents. But people without a disorder, communicating is therapeutic to many. For adolescent behavior and cognitive therapy, it's a form of therapy used to help adolescents with their thoughts and behavior. It also considers how the child's environment can contribute to their behavior and thoughts. The goal of promotion and prevention is to improve an individual's ability to control their emotions and learning coping mechanisms to deal with things they cannot control. Promotion and prevention programs require multi-level strategies with different delivery platforms such as digital, media, school, and communities. One of the most important things that will help promote mental health awareness is education. Education on mental health illness is vital for not only providers but for the community. So, in conclusion, maintaining good mental health is not only important to live life, but it is important to maintain a healthy lifestyle. Listed above are some ways to maintain positive mental health, such as seeking help when necessary, living life, enjoying time with friends and family, staying positive, helping others, and developing coping skills to get through your everyday life stressors.